Okay, this is tonight's session, which is Thursday night, April the 2nd, 2020. We're enjoying all our time down, not. And we're trying to make the best of that time by making lemonade out of lemons. And so this evening, the IABDM has invited Dr. Richa Joy. And we call her Dr. Joy because none of us can say her last name. She's an MD that is a functional medicine. And Richa, I'm going to turn it over to you, and you can tell us more about yourself, and you can pronounce your last name.
Okay. There you go. You would. Okay, wonderful. Wonderful. Good evening, everybody. I'm hoping I can all hear me. Don, can you hear me? Wonderful. Let me just expand this. Okay, so my name is Richa Gunlapalli. So I go by Dr. Joy or Richa Joy, and I'm from India, and I'm a biological medicine practitioner based out of Woodlands, Texas. And my background is, today what I want to share with you is my training, my background, and also the way I see the human body or the human being. So biological medicine doctors are more prevalent in Europe and Switzerland and Germany, France, but not as much in US. So I would like to share a little bit about biological medicine today, and also my journey, how I have come across biological medicine, and also a little bit of a difference between biological medicine and also functional medicine, because most of you would be knowing about functional medicine, and some people use these two words interchangeably. I would like to show the similarities and also the differences. So we will start with, I'm hoping, Don, is it 1 hour meeting or hour and a half?
The meeting is an hour, but your sound is in and out.
In and out? Okay, let me probably change to a different room. Just hold, give me a second. Stop the meeting. Okay, John, how is this better? Okay, how is this?
You have to talk for a minute so I can see.
Okay, great. So I'm going to tell a little bit about myself, and I will start with a PowerPoint because I made a little bit of a story, so it's easy for you to follow. Let me share the PowerPoint slides. Just give me 1 second. Okay, share. Okay. Can you hear me all right, John? Shall I go ahead?
Try not leaning so close to the computer and see if that makes a difference.
Okay. How is it now? Is it a little better?
Yes, it's better.
Oh, wonderful. Great. So this is how I see my patients or my clients who come to see me. That consists of patients while this. So as we known as practitioners, because always we are also practicing. Okay, let me get a different room.
Don't try to see if you can. Do you have your phone in there also?
I don't have. Do you want me to use it?
I don't know. But is it just me, or can others of you hear that it misses about every other word?
It's missing about every other word.
Okay, let me see. Just give me 1 second. Let me see if I can use my hotspot to connect to the Wi-Fi computer. Just give me a second.
technical difficulties. Hang with us here because I've heard her before and she's a really good speaker.
Should I choose the hotspot?
I don't think it's a Wi-Fi.
Dawn, should I log in?
No, it's
No,
still doing the
okay.
same thing.
Okay, just 1 second.
Okay, and someone here says, if you try to just sit directly in front of the computer and not move, maybe the movement is what's making the echoing sound and making it drop. So try sitting real still.
Okay. Okay, let me talk a little bit. And if it's still the same, then I will do something else.
It's good so far. So just stay right there.
Just stay still like that. Okay. Okay. So. Okay, everybody, this is my journey. So I'm a board certified physician. I did pediatrics and family medicine at the University of Illinois, Chicago. I did my medical school back home in India. Now, after finishing my residency at UIC, I got interested into integrative and holistic medicine. So coming from India, it's easy to learn or understand Ayurveda. How is it done so far? No. Oh my God, I'm so sorry, guys. Hi.
Carol, can you hear any better than I am?
No, it's about the same. I was wondering if she has any like earplugs, earphones that she can plug into her computer. Sometimes that might take the static out. Do you have a headset or anything like that that you would be able to use?
Video.
If it's a Wi-Fi issue, it will get resolved if it's a otherwise something else.
So, it's not acting. So Dawn, everybody is having the same problem. They could not hear me.
Well, Carol and I can't, so yes. Yeah,
Yes,
saying-
it's muffled.
Yes, they're having the same problem.
Should she log off and log back in? Would that help?
Why don't I do that
Yeah,
once?
try to log off and
Let me do that, Dawn. Just 1 second.
Bye.
Leave meeting.
Look at my background now, Dawn. Haha.
Oh, it's black.
Says my logo.
Your logo's backwards.
It's backwards? Okay, I gotta fix it.
There's a mirror image on
Because
there.
for me, it doesn't look backwards. For me, it actually looks like it says holistic. It's funny.
But trust me, it's backwards.
I believe you. I'm going to fix it right now. All right.
Poor Richa, we're having an issue not being able to hear her.
No.
Is Fran on? No, I don't see her. Okay, there's Richa coming back in.
Okay, hello, Dawn. How is the voice?
So far, so good.
So far, so good. Okay, just have to log in and log out. I could see Teresa, Dr. Scott. Okay, let me share the screen. Okay. Okay, so take two.
Yes.
Okay, so I'm going to talk a little bit about my journey, how I came across biological medicine, starting with my journey from the medical field. So I did my medical training back home in India, came and did my residency here. And after finishing my residency, I felt something like incomplete, or I'm not doing justice to my patients. I was not very happy with the results and the side effects of the medications and increase in the chronic health condition. So coming from India, it was easy for me to connect with or understand Ayurveda, because we all grew up with using spices in the kitchen. It's the kitchen pharmacy. So I went to India and learned Ayurveda. And then afterwards, I wanted to leave for Himalayas. Please don't ask me why. But at that point of time, I want to go to Himalayas and live in the nature, in the mountains, meditating. So I thought it's a good idea to learn some acupuncture, and you can carry some needles in your pocket. And if somebody needs help, you can do some acupuncture. That was that was the interest at that time. So I learned Chinese medicine, not herbal medicine, but acupuncture, moxibustion, auriculotherapy, and pulse diagnosis. And then went into biodynamic farming, which led me into anthroposophic medicine. It's based on Dr. Rudolf Steiner from Austria. And then got into mind-body medicine, including yoga, meditation, breathing. And it's like kind of from gross, I went to subtle. That's basically what it says. As my consciousness expanded, I was coming across more subtler forms of medicine to understand the person, the human being. I was teaching energy medicine internationally to a lot of doctors, and I was really passionate about that, but not using technology, not using bioenergetics or bioinformatics, but more based on using your hands to measure the energy centers and using some psychic faculties, which are easily to train, trainable faculties. So I was traveling and teaching energy medicine. So at this point of time, I moved to Chicago from Texas. So when I moved to Texas from Chicago, all these things happened when I was in Chicago. I realized that it was really difficult to integrate these ancient systems in the culture, in the Texan culture. But in thing at the time that was happening was a functional medicine. So I realized that it's a good idea to do some functional medicine, to get some certificate, so people can relate to me easily. So I went to the training, I went to IFM and did functional medicine training. And I didn't, especially after going through all these ancient medical practices, I felt that it was not a complete science. And I always want to understand the philosophy behind treating a person. So, but it helped me to help with addressing the nutrition part or hormone imbalances in a person. And after the functional medicine and epigenetics, I went into biological medicine. So I was driving from Houston to Dallas. And as all of us will be listening to when we're driving, we listen to these podcasts and webinars and summits, trying to understand and learn. So I heard a speaker who spoke about biological medicine. And I was like blown away with the content he was speaking. And it was fascinating, the quality of information he was providing. And I did some search on him, where he is, what is he doing. And he mentioned in his bio that he had training with Dr. Thomas Rau at Switzerland in Paracelsus Clinic on biological medicine. And luckily, 2 months after Dr. Rau was coming to US, so doing his biological medicine training. So I started my training. It's a 2 years training and certification. And I finished that with my final certification in Switzerland a few years ago. So biological medicine and biological dentist, they work together in one roof. It's like one system. It is not two different things. And that is a traditional biological medicine practice. The two systems are together. And after the biological medicine, I was interested in the biomagnetism. It's like your soul calling, right? So when you have so many, you come across different modalities, but you feel connected more to one system, and you feel like you have to take a sip on it and juice it up and understand it and create your own approach. So I recently learned biomagnetism. And so what I do now is I do something called synthesis science or synthesis medicine based on all these modalities together. So each person, we need to have enough tools in our toolbox so we can see which one works well for each person. So I'm going to talk a little bit about the ancient sciences. Let me go to the next slide. Okay. So before we do that, I forgot this slide I had. Let me do this. Okay. So human being, as we all know, not only have the physical body, we are emotional beings. We are suffering now with not able to connect with people, talk to people. We miss the human emotions and relationship. Yesterday I was having withdrawal symptoms that I'm missing people. I'm not able to go to the restaurant and sit and eat and share and laugh. And I was having those withdrawal symptoms the other day. And we're also energetic beings. We all know that. We feel, even though we don't use the word energy as much, but we are sentient beings, and we say that I don't feel good about it when I go to this room, which is very high stressful, or when people are happy. A simple thing, when you wake up in the morning listening to a good music, you feel good about it, is because you're being energized with that music, like sound or a color. When you open the wardrobe looking into what dress I want to wear today, is because you're missing that color. You're having color deficiency. It is a frequency, it's energy. So you pick on certain color. It's because you have the deficiency. So energy is also, color is also energy. So, and also mental, we know that we have mind, we think. Brain and mind are both different. So we are like complex beings. We are interacting constantly with our environment. So we have physical component, energetic component, like meridians and chakras, or energy fields or biofields, emotional beings. We are also mental beings. We're also spiritual beings, because we always want to have meaning and purpose, and we are mission driven, and we wanted to feel and the interconnectedness of humanity. And we are extension of the cosmos. So that's why ancient sciences always focus about astrology or feng shui, and even the Mercury retrograde happening, and this equinox, and there's always interaction of the macrocosm with the microcosm. And also the lineage. So there is also timeline to it. It's not only the space, but also timeline. So timeline is the disease doesn't happen today. It's been happening for a long time. So the past is like, time is relative. Past for a hummingbird is different. Time for a hummingbird is different than time for us, and time for a turtle is different than time for elephants. So time is a relative component. So when we look into our health and well-being or a disease, we have to always consider the timeline. So timeline can be our immediate ancestors, or forefathers and great grandforefathers. So it can be a huge past. We have to also consider, which we talk about epigenetics now, but also we have to keep in mind that disease has a timeline. So timeline in the sense we have to look into the birth history, in utero history. And I came across a research where a horse was scared of water house because it has the previous generations of the horse in the past was bitten by a snake and it died. So the memory of that was there for 7 generations in the horse, and the current lifetime, the horse was like, in the sense current, the horse was scared of this water hose because it has the memory through the genes that came through the ancestors. So this is how I see a person, is like, we are these complex human beings, but what is the best way to enter the person, enter into the field? I think that is a more challenging thing. modern medicine, as we all know, focus on the physical part of the body. That's why we're not able to solve a lot of health issues, because it's just a small, very, very small percentage of the being. Because this is the ancient systems. I'm just wanting to reflect upon the richness of these ancient sciences we have. And human being has been there for very, very long time. And the modern medicine, as we know, just was 200 years ago. So coming to the Ayurveda, I'm talking about this because I have more experience on that. I'm not trying to just say that this is the only important ancient science. So, but the important thing here is it's a constitutional based medicine. That means like they have very strong philosophy. The philosophy of Ayurveda, which means Ayur means life, Veda means knowledge. It's a knowledge of life and also living. So in Ayurveda, it's based on 5-element philosophy, which is air element, water element, space element, and earth and fire element. So if you look into the microcosm, that is like small life beings, including human beings or animals and plants and nature, and also the cosmic, macrocosmic beings like constellations or planet and stars, they all have these 5 elements in common. So, and we are, as we know, we are a part of that nature. We also have those 5 elements in us. And they break it down into 3 doshas. I don't want to go deeper into it because it becomes a little bit too technical and a little jargonish. So just understand that what we are made up of, these 5 elements are also there in the cosmos, and the cosmos is also made up of us. So it's like a bidirectional communication happening. And based on your zodiac signs and your constellation you're born with, so you also have your 5 elements based on that. So your constitution is not just based on what you're born here. It is also how the cosmic constellations were arranged when you're born. Those 5 elements are reflected in your body. I thought that was fascinating concept. So for example, for me, if I look into my birth chart, based on the Ayurvedic, this constitutional, the doshas. So there are 3 doshas in Ayurveda based on the elements, the 5 elements, called Vata, Pitta, Kapha, 3 doshas. And each dosha has certain elements. So based on my astrological chart, I have 20% of Vata, which is the air element. Sorry, 40% of air element, 40% of earth element, and 20% of fire element. So I would know that based on my pulse diagnosis in Ayurveda. But the fascinating thing is I don't even need to know the person. If I know the birth chart, I can tell you exactly what percentage of element you have in your person, in your being. So it's like this is all, it's like there's a higher intelligence that is governing our life purpose and life journey. That's what I just wanted to bring it on. So in Ayurveda, the diagnostic tools they use is more pulse diagnosis, which is bioenergetic science, tongue diagnosis, eyes and face, and they look into your stools, your urine, all those things. They don't have the blood testing or like the way we have it nowadays. And they focus on your routine, your lifestyle. So because we are a part of nature, so what time you have to wake up, what time you go to bed, it's called dinacharya, that is the daily routine. And also seasonal routine. So each season also you change. We know about the seasonal depression and all these things. Even the nature, you have summer vegetables and winter vegetables. So what are the changes you have to make in your diet and lifestyle so that you can prevent the disease that happens in that season? They also talk about, they use a lot of different herbal medicines and huge on detoxification. It's a 21 days detoxification during transitional seasons like spring and fall. That's the time, actually, this is the time to do detoxifications. And these are all yoga, marma therapy, breathing. These are all more subtler forms of healing that is a part of this Ayurvedic science and astrology, chanting. So what I'm saying is these ancient systems are so comprehensive. One is very individual based on your constitution you're born with. Number 2 is the diagnostic tools are very different based on bioenergetic testing. And number 3 is they have both lifestyle, nutrition, your related with your nature, sunrise and sunset. They have detoxification programs and rejuvenation programs. They have movement, they have breathing, they have meditation and mindfulness things. And they also have the bigger feng shui over looking into the person's well-being. So that is such a comprehensive science. And it's very similar to Chinese medicine. So Chinese medicine is the same, sorry, it's not 5,000 years old. That was my mistake. It also is made up of 5 elements in Chinese medicine. Little bit different than Ayurvedic medicine, but it has a similar pulse diagnosis, tongue diagnosis, iridology, and the face reading. And,
looking at the list of.
Okay, something disappeared. Okay. And they also focus on the diet, lifestyle, herbal medicine, but the huge component in Chinese medicine is the acupuncture or acupressure or reflexology. And the movement they have is Tai Chi and Qigong, and again, similar to mindfulness, meditation practices, a lot of those things. So very similar to Ayurvedic science. I'm not going into all the things I've gone through the training, but I just wanted to bring the fact that ancient systems are constitutional based, means what is the elements you're born with, which are extension of your, the macrocosm principle into the microcosm. And functional medicine, which is very popular, very common in US right now, and has done a phenomenal work to bring the conventional medicine into one step forward into integrative medicine. It is not based on the constitutional medicine. That is one big difference from the ancient science. So it is not individualized. It is, even though they talk about personalized medicine, it is not really comprehensive personalized medicine. So, and also it's not based on bioenergetics. So when they hold the Vaidyas or the ancient doctors and the healers, when they hold the pulse, it's basically you're tapping into the energy, bioenergetics of the person. So that philosophy is not there in functional medicine. That is like a huge difference compared to the ancient sciences and the functional medicine. It has definitely helped us to be able to transition from modern medicine, because you're also replacing doing the blood test and the urine test and the stool test like the way we do in the conventional medicine. We do also use replacement treatments like nutritionals or herbal remedies or hormone replacement. But so it's like a bridge between the ancient sciences and the biological medicine. It's like a little small component, which is easy to communicate. So we need a easy platform to communicate as a transition science. So functional medicine is like that. And it is not personalized because it is also protocol driven. So when you talk about protocols, it's generalizing things, but not personalizing it. So that's the main difference, I think, for functional medicine. And also there's a lot of other differences, which we'll go into it later, but more focus is on nutrition. It's a lot of emphasis in the functional medicine on nutrition. They do a lot of testing for vitamins and minerals. They do also hormone testing to look into what are the deficiencies you have, and you replace them. And they also talk about lifestyle, different kinds of movement and exercises, and sleep routine. Nowadays, that's a very important thing they talk about, is a circadian rhythm. Stress management, they discuss about breathing or mindfulness or walking, journaling, all these traditional way of releasing your stress. They speak a lot about gut microbiome, this because there's a lot of research happening about the gut microbiome. But interestingly, all the ancient sciences talk about the philosophy that your disease first starts in the gut. So in Ayurveda or Chinese medicine, we all focus on the gut. Gut is an important concept. So functional medicine is also catching up that there's a gut is so important. So they talk a lot about probiotics and all those herbal remedies to kill any infection in the gut. And detoxification is also very limited in functional medicine. So some people do some liver cleanse, or some people do some paleo cleanse, or some intermittent fasting, or 5-day cleanses. But detoxification is a whole complete science by itself. It's very, very complex. It's not black and white, and you would cause more damage if you don't know what you're doing with the detoxification. And especially when it comes to the chelation, the heavy metals. the body has to be brought into a parasympathetic state of mind before you do any detoxification. At least the heavy duty detoxification, because if your body is in a sympathetic overload, then you're in flight and fight mode, and in your flight and fight and survival mode, your body wanted to hold on to things than release things out. So if your body is in a parasympathetic mode, which is for rest, relaxation, digestion, and rejuvenation and detoxification, then your body is like naturally letting go of things much easily than holding on to these toxins back. And then we have like 6 detox organs in biological medicine. We focus on primary emenctories and secondary emenctories. The primary detox organs are your liver, your intestine, your lymphatic system, your kidneys, and so liver, intestines, kidneys, lymphatic system, and the 2 of them which are secondary. 4 of them are the primary, and the 2 secondary ones are your lung and your skin. So if the primary detox organs are too full, then the body the toxins get released through the secondary detox organs like skin and the lungs. So you get skin rashes and all of those things. So when you detox a person, you have to first see which organ you want to use to release, and then the secondary detox organs also open up eventually. And functional medicine also use herbal medicines. Most of the times it's about dandelion, or it can be chamomile, some basic herbal medicine, but it's not a very complex herbal botanical medicine. So this is a little bit on functional medicine. They don't talk about meridians, they don't talk about energy, they don't talk about bioenergetic testing. What else? Epigenetics is also is more used nowadays because of nutrigenomics, and they realize the importance of nutrition being very specific to based on the genetics of the person, including what nutrients you're going to give, or what hormones or what medications are properly assimilated by a person based on the genetics, their genomics. I believe that is because the results are very good with functional medicine, but they're not getting the results what they would want. So because the constitutional medicine is missing in their science, so they're trying to find other ways of compensating. So nutrigenomics is like similar to constitutional medicine in functional medicine, but yet it is not really complete, because you can have the genotype, but that doesn't mean that you're expressing phenotypically. So you may have the genetic imbalance, but that doesn't mean that it has already expressed the defect in the physical being. Okay, now we'll talk a little bit about biological medicine. So biological medicine is basically after Paracelsus, but the philosophy, the philosophy is the same for functional medicine. That we have to go to the source of the problem and address the innate healing capacity of the body. Even though the philosophy is the same in both functional and biological medicine focus more on a very huge comprehensive science. So it actually has its roots from Ayurveda. So the ancient Greek scientist brought this philosophy of constitutional medicine from Ayurveda, but they kind of like expanded more into homeopathy, and it's biological medicine. Medicine is a huge, big umbrella where you integrate the ancient sciences, which has constitutional bioenergetic philosophy, along with integrating the modern philosophy of bioenergetics, like using sound therapy or light therapy, or using laser lights or infrared saunas, or bioresonance information fields. So it's a very huge, very inclusive science. That's why I like it so much, because I learned many things, but it's like a one system where everything can work together without having a disharmony, because the philosophy, the foundation is to support the innate healing capacity of the human being. Because as we all know, in nature, there are no doctors. You know, of course, we have pets at home and we take them to the veterinarians. But in nature, it has a self-healing capacity. It has self-regulation capacity in animals and plants and in microorganisms. So we are a part of nature, and we also have the built-in innate healing capacity. The challenge happens because when we block that capacity, because there's a lot of man-made diseases that happened because of industrialization, modernization, and all of these things, globalization. So we are causing more impediment to the innate healing capacity. So it's based on doctrine vis medicatrix naturae, or healing power of nature. We all have inherent self-healing and self-organizing capacity. So 1 second, let me move this here. Okay. So biological medicine is about treating living humans with biological, synergistic, symbiotic, and organic medicines that our bodies and genetics, actually that's spelling mistake, genetics have evolved with for hundreds and thousands of years ago. So it's very important to understand that, you know, because we are, even though the society is evolving so fast, but the bodies are not actually. So we have to understand what we are putting into the body. We can't do the GMO, genetically modified foods into the body because that is not natural, and our ancestors are not exposed to that. It's a new information into the body. So it's creating a lot of chaos in the bodies because it's not natural. And in biological medicine, the way we see it is, one important thing is we don't label the person with a disease. So it is not like, okay, you can have high blood pressure, diabetes, cholesterol, cancer, Alzheimer's, dementia, whatever. All these diseases are labeled, so we don't focus on diagnosing. What we look into it, what is blocking this person's capacity to heal? What is blocking this innate healing capacity? And remove those blockages and support the organs for it to regenerate and rebuild. It's very simple philosophy. So, and that's the beauty of it, because once we start labeling the person, and sometimes some patients identify themselves with that label, and the whole life is like, my name is this and I have this. So instead of living life, it's all about like, you know, getting stuck and stagnant with that label and becoming disempowered. That's one beautiful thing in biological medicine is if you see a traditional biological medicine website, they usually don't talk about, I see patients with this condition, that condition. You don't see that pattern. But to be able to connect with patients, we talk about in the conditions we see in the practice. But in general, a biological medicine practitioner should be able to see all the cases. And also, we all know that the chronic diseases are increasing in number, and the acute diseases are like better compared to the past, many years ago, because of our diet and lifestyle and the toxic environment we live in. So each disease in the past, like if you had one disease, you know, like this disease is caused by this infection because it's one-on-one. But nowadays with the chronic diseases, you need to see at many different angles because there's a lot of reasons for having the disease, which is called as multi-causality of all diseases. So we believe the cause of idiopathic disease, because most of the diseases we don't know the reason or unknown cause, is because they're actually complex presentations of co-causes. So there's a lot of different causes which is causing this condition. In biological medicine, we separate and treat the several components that make up the idiopathic complaint. This is the real complex, really, the doctor has to be like the provider has to be like a detective, like trying to understand, okay, this is the puzzle, how do I solve this puzzle? What is the best way I can move this person, enter the person, and open up the person with having less side effects or less discomfort for the human being. And that's a tough thing I also encounter in my practice. We don't treat named diseases, we treat the specific diagnosis or specific presentation. Should be a presentation. What is that presentation they have? So you address that than treating the label the person comes with. So for example, I have this issue because when I see functional doctors, what they're having is you give them supplements, you give them herbs, and you give them a lot of hormones. But imagine a gut is not absorbing these things. So there's a lot of people you would be encountering if you start with some basic B vitamins and they're having nauseous, they're throwing up, or they can't tolerate that, they feel palpitations. So even a smallest dose of certain nutrients, you'll have huge side effects, or they're super sensitive. And these numbers are increasing the number. So I'm seeing more and more patients in my practice, if they can be like 14-year-old child, she can't just take a small dose of vitamin C or small dose of most common issues is the B vitamins because of the candida and all these methylation issues. So oral tolerance of medications has been very, very challenging these days. Number one. Number two is like IV, we can't just keep on giving IV nutrition for the patient. So we have to look into other alternate ways of addressing the human being. So today, in fact, I saw a patient who had the same issue. Actually, 2 patients today had the same issue. They can't tolerate oral medication. Their gut reacts. They start having detox symptoms, really tough for them. So we have to use more bioenergetics, the bioresonance or using bioimpedance or biomagnetism or using light and sound and color and different forms of energy techniques so that we can help them with less, just not depending completely on the oral intake of these medications and the drugs. I think that is where the big challenge happens from functional medicine people. So they have to open up into the bioenergetics science to help the person. Next. Okay, so this is one picture, multi-causality of diseases. So all chronic diseases we have to look into the toxic load, the chemicals, the heavy metals, all these things, intestinal flora, mineral deficiencies. And this is not yet complete. This is just like a small little piece, and you have to look into their EMF radiations, their geopathic ley lines. You have to also look into their emotional stressors, their relationship issues, and also their meaning and purpose also. So it's more complex than just this small little thing, but it's a good understanding. This picture gives us to see how complex these chronic diseases are, of course, including the dental foci also is not mentioned here. Okay, this is one more nice picture from my mentor, Dr. Rao. So, sorry. Okay. To move this to one side. Okay, there you go. So most of the diseases happen usually once you start reaching 35, 40 years of age, because by that time you have enough capacity. So you imagine your life as a barrel. We have this diet, this irregular eating habits or sleeping and EMF exposure, or all these stressors we have as part of life growing. But you have a capacity. Your barrel still has the capacity, but after a certain age, most of the times I see around entering 40, after 40, because the hormone changes are also changing and you don't have much of regulation capacity. That's when the barrel starts overflowing, and that's when you present with a symptom. So instead of like wiping the floor, you have a symptom. If you wipe the floor, you still have the overflow of the water. So if you open the drainage, so the barrel makes some extra holes. So if you imagine you have input pipes to the barrel filling up 10 pipes, if you have only one pipe that is like draining this, you're going to have overflow with symptoms. So you need to have like at least like as many as possible, at least 10 or like even 5, whatever. And what I'm saying is if you have more drainage from the barrel, then you're not going to have overflow symptoms. That's a philosophy of biological medicine. So much emphasis on detoxification. So imagine, look at this, so many stressors we have in our system blocking our healing and our regulation capacity, triggering acute diseases or disturbance foci, means like interference fields. This is a huge topic for future, especially very important for the biological dentist or dental doctors, because 80% of your disturbance fields are energy robbing problems, issues, chronic infections, inflammation. A lot happens in the mouth. 80% of the issues. So every patient who comes to me, I look into the mouth because it says a lot about the health of the person. Endobiontic load, mineral deficiencies, and all this stuff, viral bacterial overloads, all the vaccinations we receive, and all the live attenuated viruses we hold on to from the vaccination is still living in the system. The immune system goes down and these viruses start growing in our body. Heavy metals and geopathic, all of this stuff. Okay, this is a very important concept also. So Cronus time. So what I mentioned in the first slide, So when you see a person with a condition, you have to go back to the childhood, go back to the in utero and ask about, the parents, what were they doing? What was it like for the parents? And then ask about the pregnancy story. If the mom has heavy metals when she was pregnant and had some dental work done, and the whole life story. So if the person is in front of me, a 60-year-old person, you're like, I have 60 years of life in front of me. So the more questions you ask, the questions to ask, the way to listen, the communication from the body and the voice and the way what colors they wear, the way they sit, the hairstyle, the information is there everywhere. But you need to know how to process this information so that you can help the person. So it's really important to understand, the whole life story of at least the significant journey of the person. These are the different diagnostic testing people do in biological medicine. Apart from examination, there's also constitutional analysis to understand what is a constitution type. In biological medicine, it is not similar to Ayurveda and Chinese medicine. It's a little bit different, but they have similarities. We call them as mucor type or aspergillic type or penicillium type. Dental exam is a huge important piece in biological medicine. Very important piece. Every person who's a biological medicine doctor need to have complete assessment of the airway issues, your teeth and the root, and meridian assessment is very important because your tooth looks perfect, but probably there's no really electric circuit going on there. It may be shut down. Organ bicommunication. There's a lot of interesting testing we do in biological medicine. Heart rate variability, looking into your autonomic nervous system, contact regulation thermography, and there's a lot of dark field microscopy, and also functional testing like hormone testing, food sensitivities, and all these things. So it's functional medicine plus means apart from that, we look into constitutional testing and also look into bioenergetic scanning testing, because disease, before it happens in the physical body, like years, like 3, 4, 5 years before, you have an imprint in the bioenergetics. So you tap into the bioenergetic testing to understand what's going to happen downstream. And the other concept in biological medicine is something called terrain. So terrain, so in the past, we know about the germ theory, where the organism is the main important thing causing the disease. Disease of the person. Don, you have an interesting pictures in the background. It's like distracting me. For a second, I was thinking, like, who is that child?
First off, that's Bill Glaros's grandson. Okay. And can you imagine if that had happened today with the shortage of toilet paper?
Right. Perfect timing. Oh my God, thank you for that. Okay, I was thinking, oh my God, this child is left alone in the restroom, like, somebody is sitting there. Okay. So, about the child, you all know that. But Antoine, I don't know to say his name, Richa. So he talks about the terrain. Terrain is the milieu, and we focus a lot about the organs in the body. On modern medicine, focus on all these organs. Ancient sciences, there's no organs, so we don't talk about the organs as such. But the modern medicine, we talk a lot about the organs. In biological medicine, we focus a lot about the interconnection fabric, the fascial planes, than the organs. So the way I explain to my patients is, imagine you're like a tree, and you have your roots and your branches, your stems and your leaves, and then eventually you're going to have fruits. The health of the vitality of the fruit depends on how good are your roots, how good is your communication pathways, and your leaves, how they're photosynthesizing and capturing the energy and all these things. The last thing that happens is the death of the fruit. So disease always starts in a tree, first in the roots. So if the roots are anyway, so it's the same thing for us also. The communication pathways are more important. The fruits are more like our organs. If this communication is blocked up, it's damaged, it's dead, there is nothing happening, the vitality is not there, then the fruits is going to die. It means your organs are going to wilt away and going to die. So we don't focus as much on the organs in the sense, we focus so much on these communication pathways to reestablish the communication. So the vitality, the minerals, the blood flow and the lymphatic drainage is much smoother. So the terrain, this is crucial in biological medicine, your interstitial tissue or your fabric. So when we look into the mouth, we always look into, is your fabric is smooth or not? Is there lymphatic drainage blocked? Is there scar tissue, tonsils, because of tonsil removal, which is causing miscommunication, misfiring of information, and which puts a lot of stress on your brain and your sympathetic system, causing kind of disbalance in your autonomic nervous system. Oh, sorry, it's late. So body's internal terrain is the root cause of disease. So we focus more on this to detoxify. So you have a device called Matrix Detoxification and Regeneration Device. So work on really detoxifying this communication fabric we have. And Louis Pasteur, on his deathbed, he finally agreed that, I can't spell this language, but the microbe is nothing, the soil is everything. So he did accept finally that it's just not the microbe, that the soil is the key. Soil is your matrix, your
Dr. Richa, do you want me to say it in French? I speak French.
Oh, yes, please.
Le germe n'est rien, c'est le terrain qui est tout.
Oh, that sounds so good, actually. Sounds so good. Thank you very much for that. Okay.
I just wanted to show off my French skills, sorry.
Yeah, absolutely. Thank you. That was fun. Thank you. So the picture on the right side is a sample of your matrix where your communication. So you see these blue color things in here? That's your organ. Okay, so from your organ, from internal communication to the organ, this is all your matrix. In your matrix, you have your blood vessels, you have your autonomic nerve endings, means your sympathetic and parasympathetic fibers end in this matrix. And you have your immune cells, you have your macrophages, you have your nerve endings, you have lymphatic endings, you have your arterioles and venules. So it's like really a huge orchestra of communication system, like highway in this matrix happening constantly. From top of your head, what happens up here, nose in the tip of your toes. This is like one system of communication. So your autonomic nervous system, your lymphatic system, your vascular system, your hormonal system, your immune system, all these major systems are constantly communicating in this matrix, in the milieu. So it's so important to have a clear communication rather than having filled up with toxins or having like a jelly-like substance instead of having clear water communication. So this is like super important. So it's again the same thing, extracellular matrix, three-dimensional network that encompasses all the organs, your tissues, your cells of the organism, playing a fundamental role in the production, nutrition, and cellular innervation. It's basically saying the same thing. And in the terrain where the immune response, angiogenesis, fibrosis, and tissue regeneration takes place. So when we do neural therapy, which is one of the techniques in biological medicine to unblock these regulation blockages in this matrix, it's a phenomenal response and results we see in people. So hopefully in the future, I'm going to talk about neural therapy. Again, this is just an example about, these dental foci. Like this person is having like heavy metals and there's some chemical, I mean, it's a lot happens. It's a lot happens about, and so I'm so grateful I have Dr. Scott and Dr. Ewing with me. I feel so empowered. If not, I don't even know what I'm going to do. Because I won't be able to help the person, because when so much is happening without taking that, addressing that piece of the body, I can't move forward. So like that. So it's so important to work together. Again, this is a really nice case on oral systemic relationship, a 16-year remission of rheumatoid arthritis after unusually vigorous treatment of closed dental foci. That's so beautiful. As simple as that. Like this, the person doesn't have to be lifelong on this label of rheumatoid arthritis and taking all these biologics and anti-inflammatory and steroids, all those, and have crippled, and it's a very, very difficult life. So just removing those dental foci, your antibodies for rheumatoid arthritis like came down. And I see this a lot in my practice, especially for autoimmune disorders. That's pretty much, I think, it for today. So what bottom line, just to recap, is biological medicine is a form of synthesis. They synthesize the ancient sciences along with more innovative. So the focus is on supporting the innate healing capacity of the body. Anything that resonates with that philosophy comes under biological medicine. And it has emphasis on detoxification, removing things that block the regulation or healing capacity, and give the information that supports the regeneration. So we believe in biological medicine, a lot of emphasis on detox and regeneration. Every organ in the body has the capacity to regenerate. That's what happens in the nature, in animals. And the other important feature in biological medicine is the matrix and the milieu. So we emphasize a lot on these intercommunication pathways, not just on the organs. Organs, enzyme issues and organ death happens at the last phase in the disease evolution process. And we have very interesting concepts or treatments in biological medicine called neural therapy. So we do some injections to unblock the regulation of the blocked autonomic communication in the body. So there's a lot of interesting things we do. Hyperthermia, we use a lot of infrared, and colonics is used a lot in biological medicine. Ozone therapies come under this, IV therapies, a lot of bioenergetic testing like meridian stress testing or bioimpedance, bioresonance testing, heart rate variability. A lot of like really progressive testing is used in biological medicine. The treatment is based on what is your training and your background. You can use homeopathy, you can use Ayurveda, you can use Chinese medicine, you can use anthroposophic medicine, functional medicine. So it's very inclusive science. Excuse me. So that's some information about biological medicine. I just wanted to separate functional medicine and biological medicine. It's an evolving field, very complex. That's why you don't see a lot of doctors doing it. And they always work in conjunction with the biological dentist. So when I see a patient, I can help the person to reach to a certain level, and afterwards they have to see a biological dentist because I can't work without that piece of information helping the person. And before I send a person to a biological dentist, I make sure the body is in a good place, the detox organs are open, their body, they have enough nutrition, or their gut health, or their immune boosting, or drainage organs are opening. So you bring them to a certain level, and then you send them to biological dentist if they need root canals or mercury removals or airway evaluation. So, and then they come back to you. So it's like a back and forth communication with them as one system. So a lot of diseases happen in the mouth. As we all know, 80% of the oral issues cause systemic diseases. So that's my little sharing of my experience and my training for today. Any questions? I'll be glad to answer.
So I have a question. I know I've made an appointment with your office. What do you usually do as a new patient when someone comes to see you? I believe it's about a 2-hour appointment. What is it exactly that we should expect on your first appointment?
So very good question. So when I see a patient in the first visit, it's actually not 2 hours, it's hour and a half. So 1 hour is one-on-one person interaction with me. And then half an hour is we have some devices we use based out of Germany, bioimpedance device to look into your whole system. And we do heart rate variability. And we also do some basic blood test, which is covered by your insurance if I needed to. So I look into your old lab results as well and what you're doing. And more than that, the whole 1 hour is your life journey. So I sit in front of them and I ask them, okay, tell me about yourself. So I go into what I shared earlier about your birth history, before that, and the whole life story, significant events that happen in your life. You had any vaccinations, any infections, any fractures and head injuries, stressful situations, any traumas, your relationship with yourself, what's your dreams, what's your purpose, what's your mission, what do you want to do with life, the whole story, physically, emotionally, energetically, and where you are today. So even though you present to me with, one patient came to me with elbow pain and stiffness, and she has done MRI, they got all this, scans done, everything was perfectly normal, but her issue was coming from her mouth. And she doesn't want to go to the dentist. I said, I'm sorry, I can't do anything. You have to go and get it checked, get the meridian stress test and, x-rays done in the mouth. So even though the person comes to me with hormone issues or gut issues or whatever issues, I wanted to know the whole story of the person, because that will give me the clues to see why did you reach where you reach? What are the triggers that brought you where you are today? So, and based on that, I have my own intuitive understanding. So I don't do the testing I use the testing, blood test, or my devices to support my thought process. I don't depend on them to tell me what to do, so if it makes sense. So I believe that the real doctor should know what is happening with the person. They should not depend on a bunch of tests and then trying to find out what is happening. That's fine. Use them as supportive for your thought process. But I need to have understanding of what is happening. And I use these testing on these devices to see how I can bring that information into more tangible understanding to help you understand. That's the first initial hour and a half testing, so your blood work, the non-invasive testing with those two devices, and 1 hour one-on-one time with me to learn about you. And also you learn about me as well. So, if it was helpful.
There's a question that someone typed in. It says, is biological medicine embracing the cannabinoid? I can't say it.
Yeah, cannabinoids, absolutely. So, there's a lot of beautiful things, and cannabinoids are great. So, as I said, biological medicine is a very encompassing system, but the key is bioenergetics. So you needed to know if that's good for you or not. So there's a way of testing if this product is good for you. And I teach my patients to do it themselves, because if you look into any research, what they tell normally is, okay, so this is very good for this much percentage of population. So there's no medicine, nothing out in the nature that is 100% good for everybody, except maybe water. So what I'm saying is it's very individual, and I have used those cannabinoids, but I don't do it on every person. Some people respond phenomenally well. Some people have adverse side effects to it. So you check with your body and ask if the body wants that, and also what dose the body would want, because you can't follow the dose on the bottle. You have to know how much dose that person would need specifically. So that comes from bioenergetic testing.
So do you also see kids with food allergies, or is it relevant?
Yeah, absolutely. Yeah. So food allergies, I do see the kids with food allergies. Most of the time it comes from gut issues, and most of the times they have in utero stress. So I usually spend a lot of time asking about birth history, intrauterine history, toxic exposure, methylation status, because disease happens, as I said, if you trace back any chronic diseases, always you get the history way many years ago. So children, yes, we do look into the food sensitivities. I don't do food sensitivity testing because I don't completely trust it. That is not the first thing I'm going to go for it. The reason being, it will give sometimes a lot of sensitivity to a lot of foods, and I disempower the person by taking all these nutrition from them, and they would not have anything to eat, and especially the children of the growing age. So so that is not how I do it. I look into the whole story, make sure the immune system is good, support the gut, support the liver, support the detox systems, and then clean up the gut with different herbal remedies. Then you do the food sensitivity. So that way you get a very small dose of foods that are sensitive to, rather than having like 20 different things they're sensitive to. So once you clean up the infections in the gut, support the detox organs, then naturally the number of triggers will reduce. That's how I address it.
Okay.
And also methylation. They all have methylation issues. So they all have poor detoxification issues that come from family, from the genes. So we have to always look into the epigenetics that are gifted from the parents and ancestors to the children.
Mm-hmm.
Does anybody else have any questions? Dr. Joy, I want to thank you for this evening. I'm sorry that we got off to a little rough start there, but it was incredible information. And I appreciate everyone being on. Tomorrow night, we're going to have Dr. Phil Malika talking about the science of ozone. So if ozone is new to you, or if you've been using ozone, you can learn from Dr. Malika. And I'm going to encourage everyone to be on tomorrow night. And this will be recorded. And tonight's meeting should be up by tomorrow. And I hope to see you guys soon. If you have any suggestions for things you want in the future, please email me, drdawn@drdawn.net, or you can get in touch with me through the IABDM website.
Dr. Richa, how do we get in touch with you if we had any questions? So like an email address?
There you go.
Thank you.
Yes, my pleasure. And thank you, Dawn, for this opportunity. Thoroughly enjoyed it. And also meeting everybody. Hope this was of useful information to you. And please do shoot me an email if you have any questions. And I look forward. I'll speak with Dawn, and we'll do something to continue some knowledge sharing in the future.
Thank you.
Thank
Pleasure.
you.
Yeah. Bye bye,
Thank
guys.
you.
Mhm.